So within the economic partnership, we have CEOs of hospitals, IEHP, healthcare providers, Epic, which is Beaver Medical. And when we brought them together to say, what is it that you want to work on? The number one issue was coverage, okay? To your previous question, right? The most expensive care is the emergency room, right? And the more people who wind up in the emergency room for non-emergencies, that just costs all of us more money. So the concept of giving people an outlet where they can get services is incredibly important. Now that being said, Robert Woods Johnson Foundation ranked rather low in the 30s, Riverside County, 27th, I think, San Bernardino County on public health. So you've got that issue, right? And then you go to the infrastructure issue, which is the history of the Inland Empire is one of growth. You were here 20 years ago, right?
20 years ago.
We just keep growing, and we're on the verge of growing from a region of 4.3 to 6 million. Okay, and it's the reason that people move here is affordability. Pick your house here in Riverside, same house, Orange County, $400,000 more. Los Angeles, $200,000 more, right? People make a decision to live here because it's affordable. And so, on top of your question, before I answer the infrastructure question, is that of our 4.3 million since 1990, there's the growing rate of people living in poverty. So of the 4.3 million people living in the Inland Empire, 809,000 are living in poverty, all right? 1 in 4 children, okay, living in poverty. And the infrastructure, the answer to the infrastructure question is, we are under-doctored and under-nursed and under-hospitaled, and even as the Affordable Care Act changes the way in which the healthcare system works, no longer focused on the hospital, but focused on other types of care and care ahead of time and taking care of yourself, that infrastructure isn't here. And so if you look at IHP and their numbers, almost 1 million people, right? 4.3 million people, and almost 1 million of them are with IEHP. And while that
so that's entirely a Medi-Cal population.
And that's a success story in some ways, but it does speak about the level of poverty, the lack of financial resources that people have, and then the stress it puts on the system.